Carrie, welcome to your first coaching session. I'm Jackie.
Hi, Jackie. Thanks for having me.
Yeah, I'm excited to have you here today. I can see that you saw Dr. Burke. I guess that was roughly about a week and a half ago. How did that all go?
Yeah, it went really good. I'm really happy with Dr. Burke, and I feel like finally I'm gonna probably get a little bit of actual support.
I'm so happy to hear that. Feeling like you have that support and knowing that you have that support is so important on your journey. Um, do you mind if I share a little bit about how I structure this first session so you can have an idea and see if that works for you?
Sounds good.
Okay, perfect. So, in this first session, we are really just laying the groundwork. I'm going to start off with you sharing a bit about your journey and really what brought you here. And most importantly, what I want to hear from you is the impact that you're noticing with migraine. How's this impacting your life? Is it stopping you from doing certain things? Is it making certain things more difficult for you? I want to hear from you if there's certain triggers that you've noticed tend to exacerbate your symptoms. I also want to hear from you if there's certain techniques that you do, different strategies that you apply that help to support you when your symptoms are exacerbated. All of this I think is incredibly important for me to understand on your journey. And then we'll kind of segue into what health coaching is and really what we can work on together on your journey. How does that sound for you?
Sounds good.
Wonderful. If you feel comfortable, I'd love for you to just kind of dive in. I might ask some questions here and there, but really just share what you feel like you want to share with me today.
Yeah. So as I was telling Dr. Burke, there's just been this increase in the last few years of just feeling like I have um more headaches, which I am now learning are probably migraines. And it's been kind of a strange journey because I used to get motion sick really, really easy. And now I'm finding out that maybe that's part of having migraines too. And so I just started feeling like gross more often. And when I started having to like miss work, I was pretty concerned about that because um that's not historically been the case. I've been able to take, just like an Advil or something like that and maybe lay down, maybe have an ice pack or a little heating pad or something. And those things have kind of helped in the past. And
Mhm.
I've been able to just kind of, reset myself. But that doesn't seem to be working quite as well in the last year or two. Getting like worse, I would say, in the last 6, 8, 10 months, something like that, where I'm noticing it creep into some other areas of my life. Having to miss like one of my nephew's birthday parties because I didn't feel well enough. And it's like, I can't be around, 10 to 12 screaming children. And that was a pretty big moment where I was like, hey, I don't really want this to be stopping me from doing stuff in my life. Um, so yeah, I chose Neura Health because I saw my primary care and they were kind of like, "Oh, well, we can maybe try some medication," but I just didn't feel like it was super supportive or well-rounded, and I didn't feel like um my regular, doctor really understood what I was asking for, and I didn't want to just have like a band-aid slapped on it. Um, in the past, I have done chiropractic, and the interesting thing about that is I did that for like 3.5 years. I had almost no symptoms during that time. I would still have motion sickness, but I really didn't have any headaches. And then I had a car accident where I got rear-ended, and that kind of kicked off some of these other symptoms. I had some testing done at that time. It didn't show anything like structurally wrong or anything like that. Insurance kind of pushed for me to have that at that point. But recently, in the last 24 months, I've had some changes in like my professional space. And so one of the things that I kind of cut out because I just didn't have time was the chiropractic. And then I saw the symptoms really creep up kind of slowly and then much more quickly after that in the last year or so. So it's been kind of like a wild ride because there's definitely like a history of it in my early like teens and 20s. And then kind of like a time where things felt like pretty good. And then I had that car accident and now it's like back to being disruptive, but like even more so. So Like I said, some of the little things I was doing before like seemed to work, but now, it's like I can literally have symptoms for like 3, 4, 5 days in a row, and it doesn't seem like anything touches it. So, feeling excited about the plans that Dr. Burke and I have made and getting started on some like more supportive medication options. But I really don't want to be on like 3, 4, 5 different kinds of like treatments. I really want to know if there's something that I can be doing that will help like kind of even things out, or maybe help me to reduce some of these like needs in the future, since it seems like I had that in the past. But yeah, I really don't know what that looks like. And that's one of the reasons why I wanted to do coaching, because I don't really know that much about migraine. I kind of thought, oh, I just have motion sickness and headaches. So this is something that's a little bit like, I wouldn't say it's shocking, but I definitely will say it's surprising.
Mhm.
And I don't know how to find information. The internet will tell you 1,000 things. Um, and so I thought, well, maybe my health coach can help me, and it's included in Neura. So I thought, why not? Like, let's see Jackie.
You're definitely in the right place, and I'm happy to be able to support you. And thank you for your openness. I appreciate you telling your story, and I know sometimes that can be difficult. And the big thing that I'm hearing right now is the severity and the frequency has increased, and it's impacting your life. And I commend you on taking the step to start Neura Health and to get the support that you certainly deserve. And you're right. There's so much information out there, and kind of learning about a new diagnosis and starting to understand it, and then have all of this information filtering in, it gets so incredibly confusing. And I hope to help support you in kind of narrowing that down and seeing what information might be supportive for you and how we can start to apply that on your journey.
Awesome.
I'm curious to hear, have you noticed any like certain things, like I'm going to refer to them as triggers, or we can say contributing factors that might be increasing your symptoms at certain times? And I can start to give examples if that's helpful for you, but I want to kind of hear just from you first.
Um, I would say definitely like hormonal changes
Okay.
and the car. Can you give me some examples of other, those are like super like noticeable, but can you give me some examples of like other things? Because I'm not really sure.
You definitely understood the question though. Hormonal changes, that sounds like definitely might be a trigger for you, as well as motion sounds like it might be a trigger. Sometimes people find that maybe on a night where they have less sleep or maybe too much sleep. So sleep
Mm-mm.
tends to be a trigger for some people. Sometimes if we skip meals, that tends to be a trigger. Certain activity, stress can be a trigger for some people, and certain things like that. And we can continue to dive in as well with those pieces throughout your entire journey here together in health coaching.
Okay. Yeah, I'm not sure. Maybe sleep.
Okay.
Um, that could maybe be one, but I'm really not sure about other things. Um, like I don't tend to be someone who likes loud noises. I don't like overly like scented things that can like it's like Bath and Body Works. No, I will be skipping that at the mall. But outside of that, I really can't think of like anything specific, but I would definitely be interested in trying to figure out what that might look like.
Yeah.
Um, it could potentially be helpful.
What about screens? Are you, when you work, are you on screens during the day?
Yeah, so I am on screens, I would say like most of the time. I don't know. Maybe if I am already feeling icky, but I'm not like tracking anything. So I don't, I'm not even, I'm not even good about tracking how many like days I don't feel well. Um, I obviously like if I'm not feeling well for multiple days in a row, maybe that sticks a little bit better. But outside of just being like, oh yeah, I had a few days where I didn't feel good and maybe I had to nap or, you know, take a longer break or something like that. I'm not even good about keeping track of how many migraines I have.
It can be a lot and it can be overwhelming. So I totally understand that. We do have a tracker here at Neura Health that we can definitely explore together if that's of interest to you, or we can explore other ways that maybe tracking can be suitable for you and fit into your life. So that can be an area that we explore if you're interested in kind of identifying these different pieces that could possibly be triggers for you.
Yeah, I think that sounds like really great, actually. Very helpful.
Yeah. If you don't mind, I'm thinking maybe we segue over into really what health coaching is.
Sounds great.
Have you ever done any type of health coaching before?
I haven't done any kind of health coaching before, but I did have a professional career coach for like a year.
Yeah, you might see some overlap there. Coming into these sessions, do you have any idea of what coaching might be?
I kind of thought maybe you'd give me some like tips or like pointers on like things to try,
Yeah.
or maybe like, I don't know, like exercises, things like that. I'm not really sure.
Yeah. And there might be some overlap there too. This health coaching is very much a collaborative approach, and we're really a team here. So there's never going to be a time where I'm telling you, you have to do X, Y, and Z, because honestly, that doesn't work. And so it's really going to be a collaborative approach. We're going to be building your plan together. Do you mind if I kind of share a little bit about how I see coaching really just fitting into your entire journey here at Neura Health?
Sounds good.
Okay. So I kind of see your entire journey almost like a puzzle. And so let's pretend we have a puzzle here. The outside of your puzzle is really built by you and your medical care team. And so maybe that is prescriptions, maybe that's referrals, whatever that is, that's going to build the size and the structure of your puzzle. Now, together, you and I are going to work on the inside pieces. And the inside pieces that we're working on, they're lifestyle pieces. And I do want to stress that I'm sure you already have pieces down in your puzzle. There's already pieces that you've worked on and you've started to kind of apply into your life. And so we're not working with a plain old no puzzle pieces inside that puzzle. We already have some, but we want to continue to fill it in. And now, when I say puzzle pieces, we're going to be talking about goals. And so we kind of named a few areas that could possibly be triggers before, and we're working on the things that we can control. And so certain triggers are uncontrollable and certain triggers are controllable. And so things that we could possibly dive into, and this is not an exhausted list by any means, are say sleep, diet, hydration, physical activity, pacing, relaxation. These are just some areas that maybe we could dive into together. And just for the sake of this example, just to kind of give you more understanding into how we do this, let's take sleep. Okay. So, say sleep was one of those areas that you're noticing was an obstacle for you. We'd dive into it together and we'd identify maybe what the obstacles you're experiencing are. And while we do that, maybe we start to identify some areas that we can start to apply. And those areas would be goals. And so we'd kind of talk through it together. Again, it's very much a collaborative approach. And so we talk through the obstacles and together we'd kind of land on a goal. That goal is a puzzle piece. So we're going to put that puzzle piece down inside of your puzzle and you're going to live it out in between sessions. When we come back together, we're going to see how that went. If it went well, fantastic. That puzzle piece stays inside your puzzle and we keep on building. If we come back together and say that puzzle piece just didn't fit, that goal that we set did not fit into your life, that's okay. Sometimes that is part of the process too. We're going to pull that up and we're going to toss that to the side. We're going to troubleshoot the whys and we're going to build a new puzzle piece that does fit. And so the idea is we continue to work on these different lifestyle pieces and we're filling inside the puzzle while you're also working with your medical care team that's building the outside of the puzzle. And the more that we see a picture, hopefully the more days and hours in your days and days in your week you start to feel better. And that's really what we're aiming for. So it's very much a collaborative approach between the medical team and our conversations here in our session to really build a very holistic approach to help support you on your journey.
Yeah, that sounds great.
That was a lot of talking though. So I'm going to pause. Do you have any questions around that or anything you'd like for me to clarify?
I think that was um really clear. I would say one thing that comes up for me is I'm not the best at like follow through. I tend to struggle with like goal setting in general. But hopefully this is the kind of space that helps me get a little bit better at that. But yeah, it sounds great. Like I said, I think I definitely know there's some missing things that I could be doing that I'm not. And I'm all in. I really want this to be better controlled and not to have it, impacting me so much.
You have great awareness around yourself, which is already such a powerful step forward, okay? And so knowing that goal setting is a difficult piece, that's important for us to kind of build off of. We want to make sure that the goals that we set are realistic and sustainable. Sometimes as humans, we want to dive in head first and take on everything. And that can just be a natural feeling that we want to do, but that's not always realistic. And so while we're having these conversations and we're setting these goals, we're taking steps. Think of it like stepping stones. We're not diving head first. We are taking small steps along your journey to make sure that, think of it like tweaks, the little tweaks that we're making into your life fit better and you can continue those. And if we have a hard day and they don't work out, we just got to jump back on. But you and I can always troubleshoot through that. And I want you to know that you're not going through this alone. You have a partner in this journey to kind of figure out what's going to be most supportive for you.
Awesome. Yeah, I think my biggest question is like, where do we start?
Right? Let's dive in.